was a headline from 2010 when the Blackhawks won the Stanley Cup. Their players were apparently using vitamin D, and so there's been this interest in vitamin D. Is it performance enhancing? Is this a vitamin, or could it be more?
Actually, this is Mike Angeline's paper that he had with Scott, a review of this, but they noted in some papers surgical seasonal variations in athletic performance, and theoretically being higher when the sun is out. UV radiation improved time performance in one study. Direct relationship was seen between vitamin D and muscle power, force velocity, and jump height in a study on young women by Ward. In some patients, muscle biopsies in athletes with low vitamin D were noted to have atrophy of the fast twitch fibers.
So what does vitamin D do? Well, you've known that it affects bone mineralization. You have to have it if you're going to mineralize bone. It does play a role in fracture healing. We heard from Scott and from Russ about muscle function, and there are systemic functions that it has in terms of preventing cancer in the rheumatological world, fibromyalgia.
So when we think of insufficiency fractures, we definitely think of mechanical loading, but I think we also have to think of systemic causes, and it may be that the systemic causes are actually more important than the mechanical loading. We know that lifeguards have very high vitamin D levels. They reach 200, and most of them are absolutely fine. There is one paper that describes high vitamin D levels and a possible increased risk of hip fracture. I don't think we really we don't know what to make of that, but there is that one paper.